Okay, so I'm going to be performing the neonatal assessment on this baby. So to start off with, this baby is about an hour old and already has been weighed and measured. So I'm just going to be performing the head to toe assessment. So first I performed hand hygiene, and now I'm going to put some gloves on because the baby hasn't been bathed yet. So first I'm going to start off with observing the baby. So I'm looking at the baby's skin color, checking for any bluish hands and feet, to check for any acrocyanosis. So I don't see any of that. Next, I'm going to look at the fall and rise in the chest, and the baby's breathing is fine, so there's no sign of respiratory distress. I'm also looking at the baby is not flagged and pretty stretched out. I'm going to start off by feeling the fontanelles on the baby's head. So first I'm going to feel the anterior fontanelle, and it feels as of a diamond shaped, and it does feel soft and flat. I am unable to feel the posterior fontanelle. Next, I'm going to just palpate around the head to feel for any lacerations. Everything seems to be intact. Next, I'm going to listen to the heart rate. I don't have a smaller stethoscope, but I would be using the neonatal size. So I'm going to use that, and I'm going to go from midline to the left, and I'm going to listen for about a minute. And the heart rate should be between 120 to 160, or 130 to 160. Next, I am also going to listen to the bowel sounds and make sure they're active, just like a normal human. So I'm going to listen to all 4 quadrants. And for respirations, I will listen to the back of the right side to avoid any other signs. Next, I am going to feel the pulses, the radial pulses, to make sure they're both equal. Then I would also feel the femoral pulses if the baby is stable, if the baby is not ticklish and not crying in movements. So they're all stable or act equal. Next, I am going to check baby's eyes. So I'm going to open them up, and I'm looking at the sclera, making sure that's white in both eyes, and it is. Next, I'm going to look at the nose. It's not bluish color, so there's no sign of respiratory distress. I'm going to put my finger into the mouth, and I'm going to feel the cleft palate and make sure it's closed. I'm also feeling the gums, making sure that they're intact. I'm going to open the mouth and look at the gum to see it's farther back down. I'm going to also look at the ears of the baby to make sure they're normal and about this same size, and there's no abnormalities with that. I'm going to go down, and I'm going to feel the clavicles to make sure they're both intact. I'm also observing the chest, making sure there's no abnormalities, there's no respiratory distress, heavy breathing, and I'm looking for any rashes or any abnormalities. Then I'm going to look at the hands and looking for any redness, any abnormalities. I already felt the radial pulses to make sure they're equal. I'm going to move on down to the legs, and I'm looking for any edema, any redness, and I already felt the femoral pulses. Next, I'm also going to check the baby's feet. I'm going to make sure there's 5 toes on each foot, and same thing, 5 fingers on each hand. I'm also going to look at the creases on the bottom of the foot to make sure there's about the same. Next, I'm going to move on to the back of the baby, and I'm just going to palpate down and make sure everything's aligned and even. I'm also going to look at the creases in the back of the legs to see if they're not even. That would show a sign of hip dysplasia. There it is. Alright. And I don't see any swelling in the feet or in the legs either. If the baby was a male, I would palpate the scrotum and just double check that everything is normal. For ladies or for female, I would just observe and check if there's anything abnormal looking. I could also observe the rectum, but I am unable to check if I won't be able to check if it's intact or not. For that, once the baby has their first bowel movement, that would tell me that the rectum and the GI system is intact in the baby. I think, and that's all. That would conclude my assessment on the neonatal baby. Thank you.